Good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, what do I want to talk about? And folks might say I'm all over the place, but that's how I operate in terms of the topics. I want to talk about autoimmune diseases, and then maybe next week I will go into the individual diseases, but just a general overview of what it means to have an autoimmune disease, right? So an autoimmune disease is when your immune system is really the security team in your body, right? Surveying, looking out for bacteria and viruses and things like that. And autoimmune is when your own immune system gets confused and attacks your own body, right? So instead of attacking the germs, the bacteria, etc., it finds a way to attack healthy cells, right? And causing pain, swelling, right? Inflammation, and a whole slew of other things, right? Now, most causes are really not fully understood, right? So it makes it more difficult in order to truly, explain and manage, right? There tends to be, familial association, right? Exposure to certain chemicals, hormonal imbalances, and there's a lot of speculation in terms of how these things, happen. How does your immune system sort of make a mistake and can't tell the difference between your own cell and a harmful cell, right? So that's where autoimmune disease is. And there's several examples of autoimmune diseases. Type 1 diabetes, right? Where the cells of the pancreas that make insulin is attacked. You have lupus, right? It affects your skin, your joints, your kidneys, and so many other organs. And multiple sclerosis is an attack on your nerves. Rheumatoid arthritis, joint pain. You have things like Hashimoto's thyroid disease. That have ever heard of that, where the thyroid gland is attacked, right? Even things like psoriasis is considered an autoimmune disease. So there's a lot of autoimmune diseases out there, right? And when you go to your doctor, you have to sit and have a conversation, and the doctor has to be able to come up with a differential diagnosis, and then order the appropriate test, not just a whole slew of unnecessary tests, but get the specific test looking for autoantibodies, looking if you think it's Hashimoto's, you want to get thyroid function. If it's type 1 diabetes, obviously you want to get your blood sugars and things like that. A lot of x-rays and things like that really don't help unless you have severe degeneration of the joints, in rheumatoid arthritis and things like that. All right, but there is no cure, permanent cure, right? But there are ways to keep these things at bay, right, and keep things under control. There's medications to calm the immune system, and these medications are getting much and much better. I won't get into this, but the key is really to maintain a healthy lifestyle, right? And eating is very important when you have autoimmune disease. What you eat, lean protein, diet rich in fruits and vegetables, right? Less carbohydrate, right? Exercise as best as you can, right? If you can't do pace walking or running, go swimming, do some stretching, do some yoga, right? Make sure your stress level is down, get enough rest. There's a lot of things that you can do. Get into meditation, right? Because again, there is no magic bullet, for this. Keep in touch with your doc. The doc also has to keep in touch with you, all right? So, historically, a lot of the patients with autoimmune disease did not do well. But if you follow, the lifestyle and stay healthy, you can live a full, active life. And you have to pay attention to these things, right? And there's a lot of these autoimmune diseases that are more prevalent in blacks. And we have to be aware of that, right? And for example, lupus. I'll talk more about these things, one by one. Next week you have lupus, you have sarcoidosis, you have scleroderma, rheumatoid arthritis that I talked about, right? More, it seems to be more prevalent in black, but the question is it predominantly a genetic predisposition, right? And there has been shown that there is a what's called the HLA type genes, which is immune related, are more common in people of African ancestry that gets affected. So that sort of puts you at a disadvantage with these autoimmune diseases, right? But also our access to healthcare, the timing of diagnosis can also influence these outcomes, right? Are we being diagnosed later when damage is being done? So we have to pay attention to what's going on with us and be cognizant of that. What about our social and environmental stresses, right? Including discrimination. It depends on where you are. Chronic stress does a lot of damage on the immune system. And we have to be, aware of these things. So if once you're diagnosed, even if it's, late and you have the genetic predisposition, you have to work at a healthy lifestyle and reducing your stress, right? So I just wanted to give folks an idea of what an autoimmune disease is. It's when your own immune system turns on itself and a particular cell type, like for example, the insulin cells in the pancreas, the type 1 diabetes, the thyroid gland in Hashimoto's thyroiditis, right? Lupus and all these other autoimmune diseases, okay? We have to take our health serious. If you're having symptoms and you suspect something, go see your doctor, all right? And doctors, please don't be dismissive, right? Focus, do a good intake, come up with a good differential diagnosis, get the appropriate labs, and try to narrow down the diagnosis so you could at least guide the patient in terms of the medications that's out there. Not necessarily not to cure, but to alleviate the symptoms and add a little bit of longevity to these patients, and also, the suffering, because a lot of these things, you have pain, and we want to make sure that our patients, the pain is at least controlled. At least we can take the edge off. All right, that's it for autoimmune disease. I will talk a little more about lupus and sarcoidosis. That's something we don't even, talk about. We could talk about rheumatoid arthritis. We could talk about the medications and things like that, and the side effects. All right, have a great day. I got to keep on moving. Peace.